In Zanzibar, mostly we have three main NTD problems: schistosomiasis, soil-transmitted helminthes, and lymphatic filariasis. Without drugs, then you cannot control these infections alone. We have seen a very big impact with our MDA treatment program. Before 2001, the prevalence of microfilari was around 17%. But by 2006, after 6 rounds of MDA, the prevalence of microfilari went down to less than 1%. These diseases, for example, the lymphatic filariasis, is also associated with the stigma in some other communities. Some people may develop depression because of the stigma they are facing. So by interrupting transmission, and then you are alleviating all these problems. When we are talking about reduction in transmission is when there are no parasite anymore, which can be transmitted to other individuals. And then this is the protection for the future generations. Because with the lymphatic filariasis, one can get infection today, but the consequences will be noticed some 20, 30 years to come. So then these interventions we are providing is more about protecting the future generation.
We have a number of communities here which for us are far to reach and very vulnerable. In some of those islands we don't have health facilities, so we believe that having community health workers in those islands, there would be a very big key to make sure these vulnerable communities are linked to services. NTDs are diseases of poverty. So by making sure we have eliminated these diseases, definitely we are elevating those communities to a higher level.
So by preventing transmission into the future generation, meaning that you can improve the development of the country, because people will be able to work by themselves and not depending on the other one.
The government leadership is very proactive. It's one of the government priorities to improve the infrastructures, both for the health facilities as well as the communities.
So with the speed of development we have in Zanzibar and the interventions we are doing, they can lead us to eliminate different diseases, including the neglected tropical diseases.
Recently, we have actually reached a milestone for eliminating trachoma, as well as lymphatic filariasis. The numbers are decreasing, so as schistosomiasis.
It's going to be a big reward for me to see my community is not suffering from lymphatic filariasis, is not suffering from schistosomiasis, or is not suffering from soil-transmitted helminthes.
We are looking forward to working with partners, to working with people who have been holding our hands throughout the years, because we couldn't do this alone. It is the partners who help us in drug distribution, Uniting to Combat NTDs, Unlimit Health. Africa is not an island. It works with the global community.
Let's unite, act, and eliminate NTDs.